very much, Auburn. Good afternoon, everyone, and thank you for taking the time to participate in this webcast. We are expecting that by the end of this session, you will be able to select 2 reasons why community health centers need to conduct community needs assessment, 2 strategies for assessing the needs of agricultural workers, and finally, to describe how those results can be utilized. The outline that we will follow during this hour will be, first we will talk about needs assessment, then address the health center program requirements. After that, we will review the process of assessing the needs, move to how to document the needs for your target population, and finally, talk about where you can find some more information and technical assistance on the topic. So let us start. Needs assessment is the process of determining what is needed by a specific community or group or groups. Needs assessment is also known as community needs assessment or assessment of needs. The topic for needs assessment is vast, but in this session we will provide an overview of the topic as it relates to the requirements for the health center program grantees. There are several needs assessment models and procedures and can be selected depending on your goals, the time, your budget, and the resources that you may have for the project. In general, the needs assessments are used to find out the health, care, education, social services, financial, etc. needs of a group, individuals, communities, or organizations. Now that we have an idea where we are going, let us talk about the Public Health Service Section 330 requirements. When an organization, such as a health center, applies for funding and is funded, it agrees to follow all guidelines and conform to all program requirements. For all purposes, it is like signing a contract with the federal government. And like any other contract, the health center must be monitored to assess its compliance with the terms of the contract. The way that the Health Resources and Service Administration assesses compliance with the 19 program requirements is through an operational site visit, in where a team of reviewers will assess such compliance. Depending on the results of the visit, the health center could face some grant conditions and could even delay funding. Before engaging in program requirement number 1, we have a question for you. So, Auburn, can you please read the question?
Yes, so for question number 1, it says, are community migrant health centers required to periodically assess the needs of their target populations? A, yes, B, no, or C, don't know. And at this time, you can send a chat to myself your answers. So if y'all can go ahead and do that. Okay, Hilda, it looks like majority say yes.
Wonderful. Thank you very much for your response. In fact, since a needs assessment is the first program requirement, health centers are obligated to demonstrate the needs of the population or populations that they are serving or planning to serve, and to update the service area when appropriate. So a health center that is funded to provide services more than one population, for example, community residents and agricultural workers or people experiencing homelessness, the health center needs to include those populations in their needs assessment to assess their needs. To assess compliance with program requirements, reviewers will determine if the health center has a routine needs assessment, a defined service area, and whether the service area is consistent with the patient origin data, which you can find in your Uniform Data System report. The reviewers will need the following documents: your more recent need assessment, a map of your service area, the list of your patients by zip code, it's actually not the name of your patients, but just the number of your patients by zip code, and the list of the sites with the zip code. That list is also known as Form 5B in your electronic handbook. When the reviewers are looking at those documents, they will be checking if there is a written needs assessment and if the assessment is up to date. If the assessment is complete, meaning it includes all the populations you are serving, and if there are any barriers to care identified. It will also be checking if the service area is accurate, as you have it in your grant application, and if the health center's services are available to all the populations, as well as if the health center mission, goals, plans, sites, and services are aligned with the needs of the population you are serving. At this point, we have another question for you. So, Auburn, can you please read it?
Question number 2 says, what motivates CMHCs to conduct a community needs assessment? A, complying with the funding requirements. B, learning the needs of the community. C, collecting data to justify additional funding. D, A, or E, all of the above. Okay, Hilda, it looks like most of the audience has said E as their answer.
Great. You are correct. Community needs assessments are community health centers are motivated to conduct community needs assessments, not only to be in compliance with the health center program requirements, but to learn about the needs of the community and to collect data to justify additional funding as well. But to learn the needs of the community, so the needs assessment serves as a foundation and guide for the health center. The needs of the community or a group is the heart of the health center mission. For example, a mission could say, meet the healthcare needs of vulnerable populations or improve the health status of a migrant and seasonal agricultural worker population. The needs assessment also informs the strategic planning and guides the delivery of services, including the service area, the target population, the services offered, the staffing plan, and the sites. Now that we know why community health centers, what community needs assessment is important and required for community health centers, let us talk about the process. When planning needs assessment, it's recommended to start it at the end. Ask yourself, what is your goal? What do you want to find out? And what do you want to do with the results? For example, so if your goal is assessing the needs of a community, what needs do you want to assess? Healthcare needs, education, social services, etc. Of what group? Are you talking about the community at large, agricultural workers, people experiencing homelessness, or all of them? What do you want to find out? You want to find out population-specific barriers to care, utilization barriers. You want to find out if there is room for expansion of your services, to add a service, a site, or a transportation, or to modify your service delivery, for example, the hours of operation, or the services you are providing. Next, what do you want to do with the results? Do you want to meet program requirements? And in addition, do you want to justify the needs for additional funding? Or do you want to determine the needs to expand services? Or to justify establishing outreach services? Or health education intervention to open a new site, etc. Next, you need to find out what data is already available and what data you need to collect. To find out what data is already available, look both internally at your health center and externally at local agencies, as well as primary and secondary data. Start with the closest area in your community. Then if you don't find additional data, then you can have perhaps to the county, state, or national data sources. Please keep in mind that collaboration is a key factor to increase success of your community needs assessment. So collaboration, collaboration, collaboration. Inviting community agents to collaborate in a comprehensive community needs assessment can be a win-win situation for the agencies as well as for the community that you are trying to assess. You know, many times we have 6 or 7 providers in the area, meaning service providers, and all of us do a needs assessment. So for us, it's one needs assessment. For the community, 7 needs assessments perhaps. So that's what I mean in terms of win-win situation. So collaboration can facilitate data gathering, can bring human and economic resources. And community health centers collect already an incredible amount of data from the community residents and day service. For example, just when you analyze your UDS data or your practice management systems or your electronic health records or your outreach encounters, you can find a lot of demographic information as well as social education and educational indicators, housing arrangements, disease prevalence, service utilization. Of course, we are talking about the group of people that you already provide services. But you also need to find out or to expand to those residents of the community or those farm workers who are not already receiving health care. So for that, you can also look at, if we are talking about migratory and seasonal workers, you can look, for example, at the UDA census for agriculture or the National Farm Worker Survey, the National Center for Farm Worker Health, Farm Worker Health Network, locally, your public housing, public education, migrant housing, migrant education, migrant Head Start, any other social services provider that is targeting then the farm worker population. You can also find information about population-specific information in the UDS census, in the HRSA web warehouse, as well as the Center for Disease Control and Prevention. And please don't forget that local hospitals need to conduct community needs assessments. So when you work with them, you may be also benefiting your needs assessment as well as theirs. Now, what information do you need and want to collect? You can, of course, collect information in terms of health, barriers to care, and gap of services, or others. These are only examples. For example, you want to find out the health status of your community, whether it's real or perceived, disease prevalence among the groups, and you are assessing their needs, social determinants of health, health disparities, etc. You can look at barriers to care, perhaps for affordability or accessibility. How many people have insurance in your area? What are the social or economic determinants that prevent people from accessing care? Is that poverty level? Is the cost too high? Is the sliding scale applicable to the community? Is your billing and collection procedures okay? Do you want to talk about accessibility in terms of, are the hours of operation that you are providing good for the community you are serving, or perhaps not, those hours are not really convenient to them, and that's why they may not be coming to your health center. Are there any transportation barriers? How about the distance? How about waiting times? How about appointment systems? Communication barriers, phone services, etc. In terms of gaps, what can be also improved? In terms of health service delivery, how is the quality of your care? You want to find out that from your community, what they are thinking about your quality, about efficiency, about linguistic or cultural competency. How about issues related to patient and provider relationship? How about customer satisfaction in general? Or other reasons why your services are underutilized? Is there any need for additional services, for additional sites, etc.? So these are only some examples of what you can be assessing. Next, we need to determine what the best way in obtaining the information that you need. For example, do you want to use surveys? You want to use focus groups, informants, town meetings, observation, so-called window surveys, or all of the above. all of them have advantages and disadvantages. The other thing you need to keep in mind when you are doing a population-specific needs assessment is what other factors are there to consider. For example, if you are assessing the needs of the farm worker population, when the migratory agricultural workers are in your area, because if you are planning there in January and in January they are in their home base, probably your needs assessment will not be as complete or will not be, will have the success and you are expecting to. What is the peak agricultural season in your area? You want to find out when farm workers are in your area, but not when they are so busy, then they will not have any time to participate in your needs assessment. So those are things that are actually very important to figure out. Let us now talk a little bit about the advantages and disadvantages of some of these methods. Keep in mind that this is not an exhaustive list. This is only an example of those things. For example, if you are doing a survey, the advantages of it is that you can collect good information on opinions and behaviors. You can reach a broad range of individuals through surveys. The data that you can collect with them will be very valid and reliable, especially if you use good random selection methods. The downside of it is that it can be very expensive and time-consuming. The questionnaire development is very challenging, especially if you need to take into account literacy level of the population or populations you are trying to assess, as well as having to translate that questionnaire in several languages. So that became really very expensive. Now the key informant, the advantages of it is that it's quick and inexpensive. The questionnaire is usually easy to prepare because many times key informants are community leaders or services providers. You don't have to worry too much about literacy. You do need to take into account and not need to worry too much about it. And usually it's in one language, so depending on the language of the population, of course. The downside of it is that participants are usually services. The one thing that also you can, key informants is good, or an advantage of it, is that by interviewing community leaders or services providers, you usually gain support for your cause, whether it's because you want to establish a new health center or whether you want to think about how to utilize these results to marketing more your services. So that is a good thing for the key informants. Now, the disadvantages is that those participants are usually service providers, not usual users or potential users of your services. There is another one that is also used, and that is the direct observation. Some people call this one-window survey, and that's also is a good idea to use it in combination with other type of methods as well. And sometimes that's the first way that people go ahead and find out if there are people experiencing homelessness in the community, or if they are agricultural workers in their area. But alone, that observation perhaps will not be a success as you expect. So focus groups. The advantages of it is that it gives you a good insight into the needs and opinions of the population you are trying to serve or you are serving. It's easy to do and it's relatively cheap. The results, you can obtain those in a short period of time. When you are talking about, when trying to assess migratory and seasonal agricultural worker needs, using focus groups can decrease the challenges with literacy, language, and timing, because you are actually tailored the guide for your focus groups for a small group of people. You can have a group of people to do focus group in Spanish. You may have another one to do focus group in Tagalog, or perhaps you can have Mixteco or Zapoteco. So you don't have to I mean, you can tailor more easy the questions to a small group. The downside of it is that analyzing the response can be challenging and time-consuming. For the town meetings, it's relatively inexpensive. You can obtain input from a big variety of people, and just like in the key informants, you can have some benefits, such as the planning and establishing public relations. The downside of it is that it's not as effective with highly mobile population. And also you need to be very careful in terms of who will be present there. Will it be really a community or will be the majority people from special groups, and can be very challenging to do the town meeting. So those are some of the examples that we have. So next, you will need to figure out once you have figured out what is the data collection method, then you need to determine what resources do you need. And here again is what collaboration is so important. Collaboration may bring some resources to you. Now it's highly recommended to explore collaboration opportunities with academic institutions. Some graduate students are looking for a community project, and perhaps your community needs assessment could meet their academic requirements. So one of the things that is also that I would like to make you aware of is that the formulation of the questions, which is the next step, is sometimes very intense and frustrated process, but very important process. So please factor in your time for it. Once everybody is happy with the survey tool, there is a need to conduct a pilot test with the same, with some members of the same group or groups that you are targeting. The test is important because it will help you to determine if the questions are well understood by the population you are trying to reach, and if it will give you the information that you need. Now remember that based on the feedback from your pilot test, you may need to modify a little bit your survey tool. Next, you will need to train your data gatherers, collect the data, and analyze that. And after that, of course, preparing the report is an important step. Because community needs assessments serve as foundation and guide to the health center, it is very important to share the results with your board of directors. Now that we have a report of the needs of your population, the next question is, what do your health center plan to do with it? Who you will be sharing the results with? Ideally, as we mentioned in the beginning of the session, obtaining data will be used for determining if modifications to the mission as needed. For example, you were serving community residents, and through your needs assessment, you find out that there are farm workers in your area. So the mission of your health center was to provide services to the community. Now, perhaps, your board of directors may be thinking about, well, let's try to serve the agricultural workers in the area, in which case your mission may add the work of agricultural workers, perhaps meet the needs of the healthcare needs of the community, including agricultural workers. So that's the first step. The second step is informing the strategic planning. Why is that so important? Well, if a health center doesn't assess the needs of the population, it may come with this glamorous strategic planning, but at the end, build all of these beautiful health centers, but maybe at the end, people will not utilize them. So that's why it is so important to take into account the needs of the population to inform the strategic planning. The next thing is to see if a modification of service delivery is needed. And when we talk about service delivery, we are talking about the population, the area, the providers, the services, and the sites. Is there any need, based on the needs assessment, to modify the service delivery to overcome some of those barriers to care that your population may be experiencing? And of course, you also want to justify funding, whether it is for the 330G funding, for the 330 funding, or for any other kind of funding. All right. Now, how do you demonstrate compliance with program requirements? Ideally, you should have a written community needs assessment report. You also will have ready for the reviewers a map of your service area, the list of your sites with the zip code, the address and the zip codes, well, meaning you form 5-1B, 5B, not 5-1B, and then the list of your patient origin by zip code. If for any reason your health center do not have a written report, you can present some alternate ways to demonstrate compliance. So one of the things that you can do is to have ready the need for assistance worksheet, the narrative section of your service area competition or your need access point application, copies of surveys, focus group reports, key informers interviews, etc., or any other substantial documentation that can show the reviewers that your health center demonstrates and documents the needs of the target population and updates its service area when it's needed. Now, your needs assessment must be periodically updated. Of course, the health center can do that anytime it feels like it, but it could be highly recommended that the needs assessment can be updated before the strategic planning process or before your health center will be competing again for the funding, or if it's going to planning to open a new site to compete also for funding for that site. So remember that the needs assessment is very critical to modify the mission or to justify the mission. Excuse me? To inform the strategic planning and to modify, if it's needed, the service delivery. Now that we have talked about the process of the needs assessment, why needs assessment is important, the process of needs assessment, how to show compliance, and why it needs to be periodically updated, we have the last question for you. So Auburn, can you please read the question?
Yes, so this is question number 3. And for those of you just joining us, if you can just send your responses in the chat box. Thank you. So here's question number 3. It says, which of the following are ways that health centers can use data from C and A? A, to inform mission and strategic planning. B, to modify service delivery model. C, justify needs for other funding opportunities. D, only C. Or E, only A, B, and C. So we'll give you a moment to submit your answers. Okay, Hilda, looks like most responses, they are selecting E.
Wonderful. Thank you very much again for participating in it, and it looks to me that you already know everything that we are talking about here, so thank you very much. I will show you next some technical assistance resources that could be useful when you are planning your needs assessment. First of all, if you go to the Health Resources and Service Administration webpage, you can find this document, which is called the Health Center Program Site Visit, in which you can look at the policies that are required and what documents the reviewers will be reviewing, and you have to have ready for them, and what the other documentation that informs that policy will be. Next, again, the technical assistance webpage in the HRSA, it has some samples and templates, resource center, and in that they have a needs assessment section in which they offer the need for assistance restore guide. That's a very good document where you are trying to complete your need for assistance worksheet with a lot of information, not only in the barriers, but also in terms of healthcare or health status. Next, the National Center for Farm Worker Health have a web page dedicated to the estimation of population, farm worker population in this case, and it has this map. So if you are interested in knowing how many agricultural workers are estimated to be in the counties that you are serving, you click in your county and it will give you that information. I have to say that this is an estimation. There is not necessarily the total number that is there, but it's an estimation based on good resources. Next, again, in the National Center for Farm Worker Health, you can see a lot of information about farm workers. And when you receive your PowerPoint, you can click in these links, and it will bring you to this page. So you can, if you are new to the farm worker community or to migrant health, these are very good resources for you to read, perhaps before you do your needs assessment or plan your needs assessment. There is also a lot of fact sheets about farm workers in several topics, and that is also an important resource for you. Next, we have a performance management and governance tool, and we have one full session dedicated to a farm worker needs assessment. You can find a lot of, in that webpage, you can find useful tools and guides that can help you to assess a population. And also, we have customized technical assistance for you. So if you are interested in planning your needs assessment or providing available data, or you need available data on agricultural workers, you need for us to analyze your data or to help you write a report or guide you to the report, I will be glad to do that. I will be at no cost to you. So just send me an email, and the email is right here. So you can let us know that you are interested in that. If you go back to the Health Resources and Service Administration webpage, there is a page called Partners Outreach, and that provides you the list of all the primary care associations and also can serve as a resource for you. And then there is national corporate agreements with expertise in several populations, including agricultural workers, people experiencing homelessness, residents of public housing, school-based, etc. The other one is the Farm Worker Health Network, which they are subject matter experts in migrant health and farm worker population as well. Finally, there are these 4 documents, and I think will be very useful for you as well. One is published by the National Association of Community Health Center, and it also guides you how to do needs assessments and support your decision making with data. The next one is Assessing Your Community Health. It's a needs assessment toolkit for people experiencing homelessness. Conducting a farm worker needs assessment is a chapter in one of the manuals for the health outreach partners, as well as the Community Health Association of Mountain Plains States in the webpage have a very good list of tools as well. So at this point, I would like to thank you for your patience and ask if you have any questions for me now or in the future. Please do not hesitate to email me with your questions and let me know if you are interested in any technical